Welcome. This is a presentation by Excel Education, the Excel Education Pre-Physician Assistant Clerkship Program. Today we're going to give you some topics of discussion. Okay, first we're going to talk a little bit about the preparation for getting into PA school and applying to PA school. We're going to talk about the competition you're going to be facing. We're going to talk about the experiences that you've had and how you can utilize them in your essay. We'll discuss enrollment to PA schools, a little more about the statistics on the acceptance rates. We're going to discuss the PA profession, a growing profession, and we'll be discussing the PA profession today. We'll be discussing as well the PA profession potential, PA training, preparation. Okay, look, we have to ask ourselves some key questions here when it comes to preparation to apply to PA school. Have I taken the prerequisite courses? Do I have a competitive GPA? Do I have the volunteer community service hours that are required? How about the direct patient contact hours? Do you have the PA shadow hours? How about leadership experience? All these things are a very important part of the application process, preparing for your essay and ultimately preparing for your interview to get into PA school. So, have you answered yes to these questions? Okay, great. There is, however, one last question you need to answer to truly understand your chances of getting accepted to PA school. So, the competition. Let's talk about the competition here. Who is getting accepted to PA school? Why is getting accepted to PA school so competitive? Think about that. It's not the simple reason you might think, the number of people applying. Sure, that's a big part of it. But why are a certain number or percentage of those people getting accepted? Why is it so competitive? Well, the main reason is because many students overestimate their preparation. So what do I mean by that? Well, look, every student that applies has all the requirements. Prerequisites, though, simply make you eligible to apply to PA school. They don't guarantee you a chance to interview or get in. So let's talk about experience, okay? So look, experiences may seem unique. This is part of your overestimation, again, of your qualifications to get into PA school, but experiences may seem unique. However, the vast majority of applicants have comparable academic achievements and experiences. So everyone kind of that has the prerequisites and experience and GPA, they're all in the pool that are the applicant pool, all right? And that number is huge. So the experiences, you may think you have a unique experience, but we'll see down the road here in our seminar that you have to really consider, is your experience or are your experiences really that unique? Think of this. The nursing assistant, medical assistant, EMT, and scribe, these are the top four most common prior healthcare employment or experiences that applicants have. So nursing assistant, 22% of applicants are CNAs or nursing assistants, certified nursing assistants. 18.3% comprise the medical assistant experience, 15.6% EMT and paramedic, and 14.7% is the scribe. So these four different experiences or healthcare employment or experience comprise 70.8, almost 71% of the experiences that applicants have. So clearly this is a huge pool of people, and those four experiences, 70%, almost 3 out of 4 of applicants have those experiences. Nothing really unique there, right? So look, experiences making up the other 30% are generally even less impressive. And why do you think that is? Well, the reason is that patient responsibility is actually further removed the farther down the list you go in terms of these different experiences. I mean, the top four experiences have probably the greatest amount of patient contact, but a lot of the experiences beyond that do not. So what do I mean by responsibility further removed? Well, let's look at this example. The fourth most reported direct patient contact or healthcare experience is medical scribe, comprising 14.7% of the applicants that have medical scribe as experience. Now, medical scribe is not actually considered direct patient contact by many schools, and most cases, virtually no direct patient contact is involved. Okay, so in other words, in most cases of working as a scribe, you'll see in this picture that the scribe is, kind of on the other side of the room of the physician and the patient, and there's no direct contact with the patient at all. You're just basically, as a scribe, writing the notes, the history and physical, as dictated by the physician or the PA. So remember this important point. The greater your responsibility for the patient, the more valuable the consideration of that experience. Again, the greater the responsibility, the more responsible you are for the patient, the more valuable that experience is considered. Because why? As PAs, we're going to be having direct patient contact, running the care, essentially, of these patients. So the more responsibility in your experience going in as an applicant, the more valuable enrollment. Let's take a look at enrollment. Did you know that 190,721 applications were submitted to PA school in 2015? I mean, that's a huge amount, more than has been ever applying to PA school in the past. To look at that graphically in terms of the acceptance rate, if 8,603 students were enrolled in 2015, that's what that number looks like, sort of in a pictorial manner. So that is an incredible 4.5% enrollment rate. And that enrollment rate is the lowest that it's ever been, at least in the last 5 to 10 years. The average national rate over the last 5 to 10 years has been 5 to 9%. So it's becoming more and more competitive to get actually enrolled, accepted, and enrolled into PA school. PA profession, a growing profession. So look, in 1980, AAPA membership was 6,975, almost 7,000 PAs. In 2000, 40,469 practicing PAs were in the United States. In 2010, that more than doubled to 83,466. So why do you think the profession is growing such leaps and bounds? The shortage of physicians, the baby boomer generation, and general expansion of healthcare. So what do I mean by shortage of physicians? Well, the physician pool is definitely decreasing. A lot of physicians that were approaching retirement age have decided to retire earlier rather than later, and in part because medicine is practiced differently today. The paperwork involved and the different hoops you have to jump through now to qualify your patients for insurance and justify care, doctors don't want to practice anymore. They're used to the way they used to practice, just practicing medicine and not dealing with all this paperwork. So they're opting to actually retire sooner. Also, in my experience, and that's anecdotal, but also in everyone I've spoken to, students, other PAs, physicians are always advising, look, go to PA school or NP school, don't become a doctor. Because again, it's become so difficult to navigate through that mountain or sea of paperwork as a physician. So the next group is the baby boomer generation. This generation is coming of age now, so they're getting into their 60s and taking their place on the rolls of Medicare. So again, that Medicare role is expanding so much. And then general expansion of healthcare needs in general, because again of the Affordable Care Act, so many more people have care available to them that whole pool of patients that are being seen now has just grown hugely. So because of these three reasons, there is a shortage and a shortage of clinical practitioners and a need for PAs. And that's why the profession is growing in leaps and bounds. So the PA profession today, look, 108,717 PAs are eligible to practice in the United States right now. Okay, demand is expected to be at 150,000 by the year 2020 and continue to grow beyond 2020. Now, what percentage, demographically speaking, what percentage of PAs are male versus female? Well, 70.3% of PAs are female, 29.3% are male. Almost 3/4, a little under 3/4 of the PAs are female. The average age is 26 years old. The median age is 36 years old. And PAs, as you know, can work in every specialty of medicine. And PAs can work in every setting, including clinics, hospitals, private practices, and offices. Now, the PA profession potential. PA profession is rated number 4 best healthcare jobs. And that is by U.S. News and World Report. So why? Well, because of the good salary, but you'll certainly make a great living. The employment rate, again, PAs are in demand. The 10-year growth, I mean, the projections for PA profession growth are, as we saw in the earlier slide, are huge. Job prospects, again, it's easy to get a job. Really, as a PA, they're in high demand. The stress level of being a physician assistant is actually not really, really high either. That's a lot to do with the work-life balance. I mean, if you're female and you want to have a family, you can work part-time, still make a great salary. There's a lot of flexibility in schedule. Of course, you know about the flexibility in practice, or you can go into different specialties. So if you want to start your career in cardiothoracic surgery, carry a pager and work 60 hours a week, not a problem. And then later you want to go into dermatology, or let's use a better example for transition, cardiology. So out of the operating room into cardiology. You can do that very easily as a PA. It's the third fastest growing profession in the country, and number one of the 10 most promising jobs in 2015. The expected growth is 30.4% between the years 2014 and 2024. And the average salary, as we mentioned before, is $111,376. PA training. So PA training is shorter than physician training. However, we are trained in much the same way as physicians. However, there's no residency, and residency adds at least 3 years to your training before you can practice medicine as a physician. The average PA training is 27 months. So usually it's like 24 months to 34 months, depending on the school you go to. And that includes clinical rotations, which is sort of like residency for a physician. There are 225 accredited PA programs according to ARC-PA website. Now, one physician can supervise many PAs, and it does depend, however, on the practice statutes of the respective states. And the way it really works as far as authority goes, it's your national boards allows you to practice nationally. Then the state regulations regulate your scope of practice in a state-by-state basis. But beyond that, the institution you work for can have its own policies and protocols that can further reduce your scope of practice, and then ultimately your supervising physician has the final say on how broad he wants your scope of practice to be in his practice. However, I can tell you that when physicians start working with PAs, if they haven't before, they learn very quickly that we really can leverage their time for them. And once they get comfortable with our ability to practice and the fact that we know that if we have questions, we need to go to them and consult. As that happens as your career progresses, or the job that you're at with that particular supervising physician, they're going to allow you more and more latitude in scope of practice. So what are the missing pieces that make those applicants who are offered an interview unique? Personal narrative. That's the number one most important part of your application. And the importance of a strong personal narrative is imperative. Most qualified students are not always the ones accepted. And when I say that, I mean it's not going to go by your GPA or your experience, your healthcare experience specifically. It really comes down to how you present these things at your interview once you've had a successful personal narrative. So it's important to have that great personal narrative. Bottom line is that personal narrative will supersede any other shortfallings you might have if it's really quality. So the PA school acceptance rate, as we mentioned, is 5 to 9%. The applicant that sells himself most effectively will have a better chance of acceptance. And the first line of selling yourself is the personal narrative. So again, ask yourself, what makes you unique? So get your interview. This is the bottom line. This is what the narrative is all about. Most students do have the prerequisites. They have the shadow hours. They have the outstanding academic credentials, honor level courses, volunteer hours, direct patient contact. But the one single item in your application package, and yes, I'm reiterating this, that's going to get you noticed and invited for an interview at the interview table, is a superior personal narrative. So I guess I've made the point. The narrative is your ticket to the interview, all things being equal. So a superior personal narrative will prevail over grades, volunteer experience, healthcare experience. And so you only have one chance to make a great first impression, and this is in the form of a superior personal narrative, because the first insight into who you are is not your grades, it's not your experience list on the CASPA, it is your narrative, because the narrative tells about you. It's your story. In fact, you need a narrative to maximize your chances of getting an interview. then that narrative, if it is quality, superior personal narrative, will rocket you ahead of the other applicants. So the major purpose of your personal narrative, keep this purpose in mind as you write it. It is to secure a PA interview. Now, this can be achieved in part by accomplishing four major objectives of your narrative. Capture the reader's attention. Represent accurately and honestly. Be seen as a real person. Make the reader curious. So you want to capture their attention, okay? And we're going to talk about this, but you want to make your narrative something special, something with a hook that just draws them in. Remember, they're going to be reading like 1,500 to 2,000 possibly narratives, okay? Even if they screen, let's say they have 2,000 applications and they screen you down to 500 or 1,000 applications where the first 1,000 don't even make the first, that cut. Maybe they're missing some prerequisite or for whatever reason. Still, somebody's reading an awful lot of narratives and you have to capture their attention. You want to represent yourself accurately and honestly. Why do you think this is important? I mean, besides the obvious, it's an ethical issue if you don't. But the other thing is that the interview committee, if your narrative passes muster and you get invited for an interview, the interview committee is going to possibly draw questions from your narrative to ask you. And if you are not being accurate and honest in that narrative, you will get caught. You want to be seen as a real person. Again, don't talk about your GPA. Don't talk about your experiences in terms of listing your experiences or your love for biology or your love for studying disease. They want to see who you are, okay? Not what you've done. And last, make the reader curious. So look, the first three lead to the fourth one. Make the reader curious. So curious, in fact, that they just have to meet you. That's the idea of your personal narrative. So making a connection. You want to make a connection with the reader. You want to establish rapport with the reader and make them want to meet you. So how do you do that? By telling a compelling story, by making a connection. And we'll talk about making a connection and rapport building with the reader, which will be important later with the interview as well. So remember, you have very little in common with that interviewer, most likely. And the most important thing you do have in common is that at one time they wanted to become a PA and you now want to become a PA. So you both have this dream. But what you need to do is convince them that you're as passionate about it as they were. The major purpose of your narrative is to bridge that gap. So how to make the connection? The person reading your narrative is a PA, of course. So what you need to do is write your narrative in a patient context. By doing this, you're going to touch upon similar experiences. Now look, you're not practicing any medicine or an allied health profession right now. You might be. But the bottom line is, by taking experiences that you've had and using those patient experiences in patient context, when you tell in your narrative these stories, these experiences, you are going to elicit a reaction from the reader, like any writing does for any reader. The idea is to find that point of commonality. If you have cared for a patient in any context, in any way, that is going to strike a chord with PAs and the PA reader of your narrative. Why? Because that's what they do. They take care of and make connection with patients. So they're going to feel a similarity between you. In a way, you're making a connection through rapport building on paper. If you achieve that goal, you have an excellent chance of winning the reader over. And nothing helps make a strong connection of rapport between people more than a shared experience. I hope you've enjoyed watching this video as much as I've enjoyed making it for you. And please send us your feedback. You can email us your feedback at letusknow@exceleducation.com. And remember, don't just chase the dream, capture it. This is Phil Festa for Excel Education.